Assalamualaikum warahmatullahi wabarakatuh. My name is NUR AQILAH binti AMRAN and I am from University Sultan Sana Abidin. So today I present about my study entitled Brain Activity of Healthy Individuals Are Not Significantly Evoked by Drug-Related Cues. So drug addiction, a chronic brain disorder, involves compulsory drug-seeking behavior despite harmful consequences. In Malaysia, addiction is a severe issue with many addicts experiencing intense craving and relapse. Unlike previous study focusing on addicts, our research examined how healthy individuals may respond to drug use. Understanding this is crucial as even healthy individuals may consider drug use despite knowing its harmful effect. In our study, healthy participants from Malaysia will undergo fMRI scan while viewing drug-related images to identify significant brain activation, and this study addressed the gap in research on brain response to drug use in healthy individuals in Malaysia. For methodology, the participants involved in this study were 24 male healthy individuals and they were chosen based on the inclusion and exclusion criteria. However, in this study, one participant was excluded due to excessive head motion during the scanning. On the examination day, participants did the drug urine test and participants with positive result will be automatically excluded. Next, they will perform task-based MRI where they will view drug-related cues in MRI scanner. The brain activity that was activated will be analysed by using MATLAB. And for data analysis, the functional data will undergo slice timing correction, realignment, co-registration, segmentation, normalization, and smoothing by using SPM12. FFS was used to analyse the data and the individual brain activation maps were generated for drug to baseline. And lastly, the brain activity for average participant were generated by using RFS. Let's move on to the result. So this is the result of RFS that shows brain activity for average 23 healthy male participants after viewing drug cues. The result from the analysis were tabulated in the table below. The finding was 8 clusters of brain were significantly activated after viewing the cues. The areas within this cluster include left concurrent cortex, right occipital pole, right fusiform gyrus, right inferior occipital gyrus, and bilateral inferior temporal gyrus. From the result, we found that these 4 brain regions that significantly activated are related to visual processing in general and they are not particularly related to drug craving. The function of this area and its relation to drug craving was investigated. Overall, we can say that the consistent activation of visual processing areas suggests a robust response to drug-related cues. Next, healthy individuals show significant activation in visual region but not in craving control region. Moreover, visual processing area may indirectly influence craving-related brain regions and it highlights the role of visual cues in triggering cognitive and emotional response related to craving. As conclusion, this finding suggests that the brain activity of healthy individuals did not show any significant activation in brain area that control craving when exposed to drug-related cues. So I think that's all from me. Thank you.